Right, and we are live. So good morning. It's November 12th, 9:35 a.m. This is the Joint Information Technology Oversight Committee. And we have a number of things on the agenda today. But first off, we're going to be having committee discussion, possible vote on rules of procedure for the committee. And we have a lot of other folks in the room. We'll introduce everybody after we get through this first part. And when we're here on October 21st, Ledge Counsel Rick Sagel had we had a brief discussion, and now we're here to review it again. And there is one change, one word added that Rick is going to go over in a moment. So the floor is yours, Mr. Sagel, to walk us through the rules of procedure again, on to where we want to go with it.
All right, thank you, Mr. Chair. Rick Sagel, Office of Legislative Counsel. And just to be clear, Mr. Chair, did you want me to go over the entire document again, just to refresh everybody, or focus on the change?
And I think we should go over all of it. I know Kath was not here last time. I'm not going to make any assumptions, but I think having fresh look at it will be good. You don't have to do it in close
word for word.
Word for word, we don't need to do.
So again, kind of a little bit of backstory here. The statute creating Jitoc does have language saying the committee shall adopt rules of procedure. It's my knowledge that this committee never has in its history. It doesn't mean you don't have to. It means you should at least consider rules of procedure. So what I've drafted is a combination of what you all pretty much already do. Some of this is covered in the joint rules and the Senate rules, but there are some things that are unique, maybe specific to this committee based on its uniqueness in various ways. So section 1, page 1, we'll start with just A, that all decisions shall be by majority vote with a quorum having been obtained. There are 6 people in this committee, so that would be 4 people for a quorum, and that would be 3 of the 4, right? You would need, if you had just 4, if you had 6, you'd also need 4. I'm sorry, let me backtrack. If you had 4 people here, that would be a quorum. You would need 3 of the 4 to have a majority. If you had 6, you need 4 of the 6 to have a majority. Math is not my strong suit. Meetings shall be called by the chair, or if the chair is not around, by the vice chair. If the committee has not yet selected the chair or vice chair, a meeting shall be called by a majority of the members. This one I think is unique to this committee because you do change over every 2 years, and it's not in statute who is going to be on the committee. The Speaker and the Senate committee on committees appoints Jitoc members. And I think, you don't have a chair until your first meeting. So if a majority of the members who've been appointed want to have a meeting, I think we should give the authority to a majority of the members to call a meeting without a chair having been elected yet. The chair and vice chair shall develop an agenda after consulting with the committee members and staff. Committee may request that members of an organization designate a spokesperson for the purpose of testifying. These rules may be suspended by a majority of the members present, and the rules may be amended by a majority vote of the members. That is one thing to note here. These rules will go on even after this next calendar year. When the General Assembly has an election, these rules will still be in place for the next Jitoc. It would be up to that committee to amend them as they want or adopt new rules. Section 2, executive sessions. A motion that the committee go into executive session shall require a 2/3 vote of the committee present and voting. So I'm not going to go over too much math, but I hope you can determine what 2/3 is. The motion shall indicate the matter to be considered and shall take precedence over all motions except to adjourn. Action shall not be taken while in executive session. For all procedures related to executive session not provided for in these rules, the committee shall follow the joint rules, which currently do not have any language for executive sessions. So if that continues to be the case, the committee would follow the procedures in the Senate rules for executive sessions. If there's any conflict between these rules and the joint or Senate rules, these rules that you will adopt shall control. Here is the proposed change, subsection D, committee members shall not make public any confidential information provided to the committee during an executive session. All notes or other documentation made by attendees during executive session shall be kept strictly confidential. So, Mr. Chair, I added the word confidential because when I thought about it, I realized that during executive session, there might be information that's not privileged that appears to be, non-important. And you don't want that information that a reasonable person would not think is confidential to be released and then have an issue because it says all information. So I wanted to narrow that a little bit just to make sure we're not having too broad of a definition. Happy to entertain a discussion about that change.
Frankly, does anyone on the committee have any questions about that? I discussed that briefly with Rick, and I think the term confidential is sufficient to cover that we can talk about the weather in executive session and then talk about it outside of session.
That was right. That's an extreme example, but not everything in executive session may be confidential, right? So my fear was that we don't want to just have a total umbrella over the entire session, but maybe you want that. Maybe you want every detail to be quote unquote protected in executive session. But I think that's maybe too broad personally.
Yeah, I think the people might try to abuse it by bringing up something in executive session, read it to make it confidential. So I think that change is welcome. In the last two sections.
Sure. Subsection E, only witnesses deemed necessary by the chair shall be permitted to attend an executive session, including witnesses attending virtually. And then F, a majority vote shall be required to exit executive session.
Okay. So in terms of all of the, and I can't see anyone online, just so you know.
Let me stop sharing. That way you can see.
At least you see.
I can bring it back if anybody wants to see it.
Great. So Kath and Monique are still online. Does anyone on the committee have any questions for Rick about the procedures? And how about any discussion in general on the procedures?
Just one piece of discussion, and this is a general question that others on the committee may want to comment on. I do have some concerns about the confidentiality of executive sessions, particularly when we're talking about matters that relate to significant security issues that may be discussed in executive session. I'm wondering if anyone else on the committee has any concerns. I know I have general concerns.
And I certainly do. That's part of the reason why I wanted to have procedures in place, because I know there had been a discussion before on information in executive session, coming out of executive session. What I found with executive sessions, not so much in my role in the legislature, but prior to that, there's very little enforcement and in discussions. And Rick, you can comment on this, is that there would be two different folks that would be potentially subject to confidentiality. That would be the legislators, and the only enforcement there would essentially be an ethics complaint. Then the witnesses themselves, and there's quite literally nothing, perhaps a contempt of the General Assembly that could be done. But in terms of enforcement, I didn't see that there was much of any teeth to it.
Yeah, so as far as enforcement goes, you're right. The ethics complaint could be made. You could, the leadership of the Senate, depends if you're a senator or a House member, you could be stripped of your committee placement. But again, you're a constitutionally elected member of the General Assembly. And these rules obviously just apply to you all, does not apply to witnesses. So, there's only so much you can do. I think at the very least, it kind of clarifies what this is and what the idea about why we're doing it, why you have executive session, and kind of just some rules in place to ensure that we know what the rules are.
Perhaps we can leave this in place right now. I don't anticipate we have any, that I'm aware of, any need for an executive session in tomorrow or the next day.
Well, we might have one this afternoon.
We might
Yeah.
have plenty of time then. I just wonder if we might want to consult with the Secretary of Digital Services office to see if they have any recommendations regarding maintaining confidentiality in a virtual session. Because that's what concerns me.
And I was surprised to not get any feedback after we had presented this last time. I'll wait a moment.
So the representatives of ADS here, and perhaps you can come back to us before we return for the afternoon session with any additional recommendations or thoughts that we should think about.
We did share a document. So maybe that's some recommendations.
Okay, and that would, Rick had that, was that shared with the whole committee?
Well, the sheriff.
Send it to you, I have.
Yeah.
Sure. Yeah.
We'll probably do that. Rep James, looked like you had, oh, your hand is up. I can see it.
It is, and then I waved. I'm not sure how well you guys can see me. I just had a question. I wanted to make sure I understood the concerns. Is the concern that members of the committee will hear confidential information and share it anyway? Or is the concern that we won't be clear on what is confidential and what is not confidential?
The issue is whether or not there is sufficient security in the virtual platforms that we use and the way that we use them to ensure that others may not be listening in or otherwise be privy to what we discuss in confidence.
Got it. Thank you.
Okay, so it sounds like, Lisa, you had a comment?
For the record, Lisa Govan, IT consultant. I know that when we do executive sessions on Zoom, they require an encrypted version of the software to be used, and that's what is used in committees. So perhaps that should be specified, but I'm not sure what comments might be. I know that's a process, so I wanted to mention it.
But when you say encrypted versions of Zoom on the user's system, is there anything that adds any layer of protection that the user's system may not be compromised, the information or the session may not be copied and left in an unsecured manner on the user's system?
I don't have the answer to that. That would be a
Those are the
category.
kinds of things, and that's just one of many potential issues about remote sessions or about sessions that are done outside of the band that we place around things that are done in the building. That's what concerns me. Could we, for example, be broadcasting on CBS unknowingly?
Okay, so clearly 15 minutes was not sufficient for discussion on this. So instead of asking for a motion to vote, I think what we'll do is we'll table this for now and put it on for the December 2nd agenda with a little more time. Hopefully we'll have some specific feedback, perhaps some requests from folks to testify regarding it if that's necessary. So unless there's more from anyone on the committee, we'll move on to the next item on the agenda. Not seeing anything more. So next item is an update on the integrated eligibility and enrollment programs, Vermont Integrated Eligibility System. I'm sorry, I'm just reading the title we have, an update on the Comprehensive Child Welfare Information System project. And we have a number of folks in the room, so we'll do introductions now. I'll start with Senator Brock to my left.
I'm Senator Randy Brock, represent Franklin County and Northern Grand Isle County.
And Rep. James.
Yeah.
Oh, we're just doing
We're
introductions
introducing
now.
ourselves. Geez, I'm sorry. I was having an internet glitch. I'm Representative Kathleen James from the Bennington 4 District.
Hey guys, Monique Priestley. I'm from Orange 2, Bradford Fairleigh, West Fairleigh, and I'm sick today, so that's why I'm here, but camera off, but I'm here.
And I'm Rob Plunkett, Senator for the Bennington District, and Chair of Jitoc. You want to introduce yourself?
Lori Morse, Committee Assistant for the day. Be patient.
We'll go around folks in the room now.
Rick Sagal, Office of Legislative Counsel.
Lisa Gobbin, JFO IT Consultant.
Garth Walker, Integrated Eligibility and Enrollment Program Director.
Morning, I'm Kristen McClure. I'm the Deputy Secretary at Agency of Services.
Morning, Brendan Atwood, Policy Director for AHS.
Hi there, Hannah Marble. I'm the Director of Communications and Legislative Affairs for DCF Family Services.
Hi everyone, Andrea Delabrie, Deputy Secretary at Agency of Digital Services.
Joey, Chief of Staff, Chief Services.
And online, Ms. Tebow, let's start with you.
Hi, good morning. I'm Carly Tebow. I'm the Quality Assurance Administrator for Family Services. Apologies for not being in person. I am also sick, though good credit for correct pronunciation of the last name. It's a tricky one and I get a lot of things, but Tebow is not usually the first, so great to be with you all.
And well, I'll go with whoever wants to go next because I've become notorious on mispronouncing names. So.
I can go next. I have a feeling that was me. I'm Erica Radke, Deputy Commissioner of the Family Services Division for the Department for Children and Families, and I'm sick as well, so I apologize for not being there in person.
You have a Tracy. There you are.
Good morning, Tracy DeRocher, IE&E Program Manager.
Well, welcome and thank you all for introducing yourselves and being patient with us. So I'm not sure who wanted to go first or how we were going to be going through this, but the first name I have is Andrea. You're not going to even try.
I have IE going first, correct?
So IE going first, great. So whoever wants to come on up and give us an update on the project.
Good morning, everyone. I will try to get this sharing for you. See, does that work? Like it is. Excellent. Thank you. All right, folks. Again, thank you very much for the opportunity to come and speak to you today. The Integrated Eligibility and Enrollment Program is a really important program for me personally, and I think for a lot of people. And the work that we've been doing, I think is really important as well. It's been about 2 years since I last spoke to this group, and I'm really excited to share the progress that we've made over that time frame. So certainly if you have any questions, please let me know, but I have set some time at the end of the presentation to also answer any questions that you might have. There is also some supplemental information that I believe will be shared after the fact, which has got a lot more additional details for you should you desire. So what I'd like to do today is just sort of go through and talk about sort of really what is the Integrated Eligibility and Enrollment Program. What are we trying to do? Who are the people that we serve? What are the programs that are within IE&E? And what are some of the current challenges that we're trying to work through right now? I then want to introduce what is, I think, a huge modernization accomplishment is really called the Vermont Integrated Eligibility System. We call it VTIES because that's easier and quicker for us to say. And I'd like to go over and just share with you how we are approaching this massive modernization effort and where we are today. I want to make sure that I can share with you as much as what I can, because I will say up front, the VTIES project is currently in active procurement. So I will share as much as what I can, but there are some things that I'll have to unfortunately defer just to maintain the procurement integrity of this project. And lastly, I want to finish up and just sort of share a little bit about the journey of modernization, because I think when people think about the IE project, a lot of the times it comes up as, haven't we been working on this for quite some time? So when we talk about the role of IE and E, I'll sort of really boil it down. Really for us, we want to make sure that Vermonters have a really easy way to apply, maintain, change economic benefit program enrollment and healthcare enrollment. It's really as simple as that. Now, of course, we want to make sure that we are using technology the way that we can, but really it's about supporting Vermonters. That's the most critical thing. The work that we do spans multiple agencies, but also multiple departments. We work very closely with the Agency of Digital Services for all of our project work. But the core of the work that we do, from a healthcare point of view, it's with the Department of Vermont Health Access. And for all of our economic programs, we work very closely with the Economic Services Division as part of the Department of Children and Families. So when we talk about the programs that we sort of involved with, it's really about programs and people. So when you look at this, we have Medicaid. Medicaid, there's different flavors within Medicaid, and there are different flavors of programs or sub-programs or even services within everything that you see on this list on the screen right now. And this is a very high-level list. But when we think Medicaid, there's certainly Medicaid for children and adults. There's also Medicaid for the age blind and disabled. We have pharmacy programs. We have Dr. Dinosaur, which provides health insurance for children as well. We have the qualified health programs, which is the state-based exchange, which I'll share a little bit later what makes that a little bit unique for us in Vermont, the way that we manage that as well. And then there's the economic programs. Certainly, I'm sure you can appreciate everything that's in the news right now is really focused on SNAP. In Vermont, we call it 3 Squares Vermont. And that's ensuring that Vermonters can get the food nutrition support when they need it. And there's also fuel assistance, general assistance and emergency assistance and reach up, which the federal names as temporary aid for needy families. In the GAEA program, it's really important to call out a lot of, in terms of what's happening right now, is certainly making sure that there's housing for Vermonters as well. That all rolls up as part of the GAEA program. I do have some numbers of how many are in each, and some Vermonters are in multiple programs, but in general, we're supporting over 220,000 Vermonters each and every year. So certainly a good number of the population are reliant on the services that we need to make sure that they have access to throughout the times, recognizing that people's needs do change. So the current challenges, firstly and foremost, is for Vermonters, it's not a really great user experience to apply for the different programs. If we think about economic programs and healthcare programs, Vermonters have to include that information on an online system multiple times. Information doesn't naturally carry over from one screen to the next screen to the next screen. So there is that data entry challenge. The systems that we have right now are not really accessible on a mobile device or a tablet. They're not really designed to be on a device that people are generally using these days. So there's challenges with the mobile access, language support, and we are always very concerned about, it's not just enrolling for the first time, it's making sure that when something changes for a Vermonter, that they can log in and they can actually indicate the change as well. So there is the risk of, if someone can't get that information into the system or if they can't apply, that they might lose coverage if their circumstances change. And there's also a challenge. Part of that is in terms of our ability to get notices out to Vermonters so that they know what they need to provide, or if they do provide information and if it's inaccurate, the current system doesn't have a lot of fail-safe measures that allow us to really make sure that we capture all of the information that Vermonters need. My colleague, actually, we did a test. We actually went through and applied through for economic benefits through the DCF portal, and we deliberately put in incorrect information every step of the way, and we were able to get to the very end with even just an incorrect email address or an incorrect mailing address. And had we hit submit, we didn't, but had we would never have known that our application was not going to be registered because there was no way for someone to get back in touch with us. So it's a very very manual process, unfortunately. So there's a lot of challenges for Vermonters in terms of their ability to also get, there's not one application for both programs. They are not integrated, hence our name implies. For state staff, because of the information comes in somewhat disjointed, it's a very manual process as well. Information for different types of Medicaid goes to 2 different systems. So they're not connected, and I'll share a little bit more about that as well. So the process is really time consuming for Vermonters, but it's equally as time consuming for our workers within DCF and also within DVA to actually process those applications. The eligibility rules are really complicated. A lot of it takes a lot of work around to really figure out what that Vermonter needs, and also recognizing that what a Vermonter applies for today, there may be an additional program that they would really benefit from if we had the right information. So it's really challenging to really make sure that providing the true service that is going to promote positive health outcomes, but also economic security for a Vermonter. Our current systems are also aging. They don't necessarily meet the needs of what we need today based on the expectations of Vermonters as well. So the cost to maintain our existing systems is relatively high, and there is now ongoing compliance challenges that we're working through to make sure that we can respond to federal mandates, accessibility challenges, or also security updates that we need to do in our current systems. So our current systems, this is about as techy as I'm going to get in terms of our current legacy systems. So we have 2. So we have the Access mainframe, which is a 40-plus-year-old system that is used by many institutions today. It is a really robust really robust eligibility and enrollment system. On the Access mainframe, we have all of our economic programs and the non-Magi Medicaid, which is essentially a Medicaid for age blind and disabled. So that's on one system. It's, as I mentioned, it's over 40 years old. One of our greatest challenges is that the people that really know the inner workings of the Access mainframe, they are retiring. That's how old it is. This is not something that people are learning in coding when they're going to college and universities today. So the pool of skilled and knowledgeable experts in managing the Access mainframe is dwindling. That is a serious risk. It's a really robust system, but it's really complicated. It's very layered. And it's anytime we make changes, we have to be super mindful of the changes that we make and the way that we do it. Then we have Siebel, which is our Vermont Health Connect system. This was last modernized back in 2013. So we have made modernization progress, but this is where our qualified health plans reside and our Medicaid for children and adults. It is an expensive system to update. It's still very complicated and time consuming to make these updates. And it's not modular in its design. And I'll share a little bit more about that when I talk about VTIs. I'll talk about what does this modularity really mean. So either system though, both systems, they're not mobile friendly. What you see on your laptop doesn't necessarily show in a really great way on your smart device or on your cell phone. And they are separate, they're not connected. The information doesn't easily pass from one to the other. Part of that is that manual process, that manual workaround that state workers have to do. So with this, we thought we would introduce the Vermont Integrated Eligibility System. This is really our solution, our approach to integrate, to address the needs of state and Vermonters today moving forward. We have a website at the bottom of the screen. that will take you to our public-facing website, where we have spent a lot of time over the last 2 years to really make sure we are sharing with the public the work that we're doing and why we're doing it, and more importantly, the problem that we're trying to solve. So what is VTIES? And VTIES, as I mentioned, it's easier to say VTIES than the full list of system. Really, what VTIES is going to be, it's what our envision is for one portal, one system for all programs. Now, as I mentioned, we are in active procurement, so I need to be very mindful of what I sort of share. So in terms of, I'll use words like what we envision, what do we expect, what do we plan it to be? These are things which you may recall from 2 years ago, we've been relatively consistent in our approach. We haven't deviated from what I shared with this committee 2 years ago. But what we are envisioning is really a unified enrollment and eligibility system that really supports people with practice and having technology support people in a way that's meaningful. So we want to make sure that we are really focused on customer experience. We want to make sure that the process is user-friendly for both Vermonters and state staff, because they are Vermonters as well. We need to make sure that it's a really enhanced customer experience. In terms of core functionality, I have another slide I'll share, which sort of talks a little bit more about what is an integrated eligibility system, but we want to make sure that there is a place for Vermonters to actually apply. That's typically for them a customer portal. Then there is a worker portal, which is what often we refer to as case management, where a state worker will manage the information that comes in to then determine eligibility. And an eligibility rules engine is really all of the if statements. If someone has this income, in this circumstance, this situation, therefore this is the program that they're eligible for. So it's a policy-driven rules engine that actually determines, based on eligibility, based on information, what is someone able to enroll in. And the other outcome of this approach is not to add another system to our existing technology, it's actually replace everything that is currently known as VHC and all of the integrated eligibility and enrollment programs currently on the Access mainframe would come off, and we would have one system for all of our programs. So that's really a critical piece as well, so that we are actually sort of consolidating our technology. The work that we're doing right now with VTIES, it's building on a lot of the work that we've done over the last several years, which has really been more focused on system stability, security updates, compliance. This is work that we've been really focused on in Access and also VHC. We're currently doing it right now because of the HR1 compliance efforts from the federal government. We have to make sure our legacy systems remain compliant. But today, VTIES is really doing all of that, but we're also really focusing on improving the user experience and also making sure that we are truly adding functional improvement for multiple stakeholders, being Vermonters and also state staff. So this is a non-technical overview. Every time I talk about this, our technical subject matter experts get a little bit queasy because of it's not connected. There's no lines. There's no data flows here. But what I like about this is really it talks about, in essence, what is an integrated eligibility system. In the middle, we've got the brains. This is where the state worker is really getting all the information. It's the hub. It's the center of the wheel where all the information comes in. But for our Vermonters, we really want to make sure that we're talking about all Vermonters in terms of the needs that they have. We need to ensure that when they log into a portal, that they have various tools available to them for them to be able to put in an application, for them to even understand what could they be eligible for based on some really basic information. That's customer screening, and that's a really important piece as well, because they may not know what to apply for, even with what they could apply for outside of the IE&E program as well. So we want to make sure that we're able to support our Vermonters, but also it's on a smart device, it's on a computer, but also there's the existing ways that they can connect, which is either in person, on the phone, but more importantly, for those Vermonters who actually don't have access to any of that, they still need support, and we need to ensure that our system can support that as well, that they can actually leverage all of our existing supports out there, where we can actually have them call up and actually, or sit with someone, and we could actually engage with them and actually help them complete the application. We have really robust assister programs. So that is why I've got the state worker in there, because they don't just live within the case management, they are also part of the application process. The eligibility rules engine, that's the thing that really looks at what are the circumstances, what's the information that they've put into the application, has any of the information changed? If we have to do annual reviews or monthly reviews, there's a lot of eligibility criteria that needs to be taken into account. And when it comes to financial, this is really where we issue benefits, whether it's issuing benefits on a EBT card for SNAP or 3 squares per month. We need to make sure that the benefits are actually issued in a way that they can actually connect with those. We want to make sure that we have correspondence, that Vermonters will be informed. They will get notified if there's a change in circumstance, or if they need to reach out and connect with us. If there's an interview that they need to go to, the system will be able to provide them that messaging that they can log into their portal and see their notices. They can then contest if there's a decision that they don't agree with, but they'll have the ability to actually look at those notices in the language of their preference, which is currently a bit of a challenge that we have today. And then at the bottom, we have other systems that we need to connect with. We send information to multiple other entities outside of the IE&E program because they also need the information that we are capturing. We also need information that is coming from other locations as well. So we call this out that there are state systems such as child support, CWIS, you hear about a little bit later on this morning, which is for the comprehensive child welfare information system. My apologies. But also a lot of the work that we do connects with our federal government. The Centers for Medicaid and Medicare Services, CMS, and also the Food Nutrition Services, which is part of the USDA, which is what provides federal oversight to our SNAP 3 squares per month program. So this is when I say VTIs, it's all of this, it's all interconnected. But the modularity piece of this to really call out is the way that we envision this to be is the ability to swap out aspects of these modules, Lego bricks of the solution is really a benefit that we don't have in our current system. Bless you. So when we talk about the what, now we sort of talk about the how. How do we plan on implementing the solution? It's a really complex, it's a massive project. There's a lot that we have to sort of make sure that we can accommodate when you think about all of those programs that we have within the IE&E program. We recognize we can't just hit start and cross our fingers and hope it works and flip the switch and magically everything works. We need to make sure that we also recognize that we need to deliver incremental progress and benefit to Vermonters today, tomorrow, next month, next year. So our approach is really an incremental approach to releasing the system as we're developing it. So the initial releases we envision will be sort of generally the overall framework of a solution, the rules engine, case management, the eligibility rules engine, and again with some functionality that Vermonters will be able to use. So we expect that making sure that is the anonymous screening calculator that they could see what they could apply for. Even if it's not a program that is currently live, they'll at least know what they could apply for and go to our legacy systems. So there's a huge benefit in just leveraging that anonymous screening calculator. Having a Vermonter being able to take a photo of a pay stub or a utility bill and upload it to the system is something that we have today, but we need to make sure that we have it accessible for all of our programs. So that is early functionality that we believe would be well received by our population as well. For the initial releases, we would most likely be looking at a smaller program to really make sure that when we release this functionality, that therein is actually some of the testing to make sure we can get feedback, make sure it works. In the subsequent phases, what we expect to see is then progressive platform maturity and adding additional programs. Whether that's 2, 3, or 4 phases, we'll have to determine that with a selected vendor. But we are really focused on making sure that once we actually begin what's called DDI, the design, development, and implementation, that's everything outside of after procurement, that we're really focused on delivering early wins. So meaningful change that people can see and providing a benefit to Vermonters. How did we get here? So that's the what of VTIs and how we plan to implement the solution. But I think it's important to talk about how did we get to this point? And really it's about, I think that the work that we've done in terms of engaging with our stakeholders and our interested parties is really important. And it's really two ways that I look at this. Over the last 2 years, when I was last here, we are in this procurement phase. We really did a significant amount of outreach and research to make sure that we were on the right track. We did multiple RFIs, which stands for Request for Information. We engaged with the vendor community to say, here's our plan. This is what we envision. This is some of the challenges that we expect. Here are some of the pain points. Does this work? Is this something that exists? Do you have technology that does this? We wanted to make sure that what we were asking for, our approach, was robust and valid. And the answer was yes. We went to many conferences. We had actually vendor demonstrations. We had these large tech companies actually come to Vermont virtually and actually show us what their solutions can do. So this allowed us to really make sure that what we were asking for wasn't something that was a unicorn. It existed in the marketplace. So we really focused on engaging with vendors. We also engaged directly with other states who have done different flavors of integrated eligibility enrollment as well. We spoke with states all throughout New England and across the country. We did a really detailed cost benefit analysis, which looked at all the different what ifs that we could have done to fix the problem. Could we redevelop access? Could we build on Vermont Health Connect? Could we just take a solution from another state and then try to rework it and customize it to suit our needs? What we identified was the solution or the strategy that I shared 2 years ago was the most advantageous, the most cost-effective approach, and also had the less risk. Still, it's a very challenging entity and an effort to do, but we recognize that this was the right approach for us. So we were able to validate throughout all this time the work that we're doing. In addition, the oversight that we have leveraged within the federal government with CMS and FNS was extensive. When I last spoke 2 years ago, we actually just sent our request for proposal, which was the procurement document, to the federal government. It took 10 months after when I last spoke with you for us to actually refine that procurement document with really collaborative engagement with our federal partners before we actually released it, which was October of 2024. We've also have routine conversations with Lisa Goffin in the Joint Fiscal Office, but also we have independent verification and validation services, which is the third-party entity that provides oversight and reports back to CMS based on the work that we're doing. So really, there's been a huge amount of engagement and conversation to really make sure that we're not designing this in a vacuum. We really want to make sure we had great collaboration across all of stakeholders. And then when we think about implementing the solution, we also want to make sure that we hear from the very important people that we're also serving, which is our Vermonters. So we're going to be designing the solution with them in mind. We want to make sure it's user-friendly and accessible. We recognize that the solution will be more mobile-friendly, which gives us an opportunity to hear from them in a language that is preferable to them as well, so we can get that feedback. But also recognizing that there is, again, we're not just going to implement and hit go live. We're going to want to make sure that we get feedback at every step of the way. And the beauty of doing a phased approach allows us to actually launch, get feedback, adjust, modify, launch, adjust, modify. That constant feedback loop is going to be really important for us to make sure that we work out the kinks in a way that's meaningful and doesn't impact Vermonters in a negative way. So, but why don't we just slow down and what's the risk of us not doing this right now? Is, well, as I mentioned, there's the systems that we have, right? Is certainly our current systems, while they suit a need, the way I often talk about it is I think the online experience for Vermonters today is so much different today than it was during COVID, but potentially even more so pre-pandemic. What Vermonters expect through an online experience is fundamentally different than what it was 5-6 years ago. So not only do we need to make sure that we can actually provide the service in a way that's meaningful for Vermonters, we still need to make sure that our systems are within federal compliance standards. There's security standards, accessibility standards, all of which, if we don't do, then we run a risk of losing our federal funding. The reality is our current systems, it's actually more challenging now to make those changes than it was ever before. The infrastructure that we have, as I mentioned, the Access mainframe is aging. It's a really solid system, and it has been for a very long time, but we've outgrown its ability to provide the needs that we have. Again, the compliance, the trying to find the right sourced skilled talent to manage and do all the work that has to happen is really challenging. Right now, as I'm sure we're all aware, the challenges with the federal government with the closure right now is we've had to really do significant technical work in Access to allow the food benefits, the 3 Squares Vermont, to be issued in a way, because that was a very quick workaround that we had to do to provide a benefit to Vermonters. Whenever the government opens up again, we have to undo that work. And that, again, takes time, it takes resource. We have to move people from one effort to another to prioritize the work on those areas as well. So we really want to make sure that we can actually maintain the operations in a way that's meaningful. But the programming that's necessary in both our Vermont Health Connect and our Access mainframe, it's really challenging and it takes time. It's not an easy thing to do. It'll still be complicated moving forward with a new system, but the newer system will have more ways for us to actually streamline some of those compliance projects that we have to do to remain in compliance. And then lastly, as the photos illustrate, access to food and the ability to get healthcare, two really fundamental things that I think are really important. We want to make sure that there's not a disruption to people's benefits. We want to make sure that we can meet Vermonters where they are in their needs at the time that they need it. So we're really focused on addressing these risks, because if we don't, then we do risk some of these things here as well in terms of our federal funding and our ability to service Vermonters. So VTIES is really about investing in people and leveraging modern systems in a way that's meaningful to them. We want to make sure that we are able to have a solution that fits the unique needs of Vermont. Now, other states have got integrated eligibility systems, which is fantastic, and it's the conversations that we've had with them. But the flavor of the system and the programs in Vermont is a little bit unique. One of the greatest unique characteristics is really a lot of other states have got SNAP, they've got the temporary need, TANF, but they don't necessarily have a state-based exchange. That is what makes Vermont unique in the sense that a lot of integrated eligibility programs or states have a separate system, the federal system for qualified health plans. So they're integrated in one area, but it's not connected in others. Vermont, we're approaching, I think it's a unique approach, but it's the right approach for what we need for our programs. As I've mentioned, we want to consolidate our legacy systems into one, which will certainly be a sort of a modern platform. We want to be mindful of the cost of maintaining them as well. We want to make sure that we have a rules eligibility engine or calculator that can evolve and change based on changing mandates, legislative mandates, rules, federal rules, state rules, based on making sure that we can actually do that in a way that's meaningful. And I think also by having information into one system provides us a really unique opportunity of making sure that we can really capture a unified, holistic view of the Vermonter. We don't have that today. Understanding by having someone in one program could lead to benefits in another sort of outcome. That unified, holistic viewpoint, I think, is really critical. And that's certainly something that we look forward to having with a new modern solution. And again, we're maintaining our federal partnership with CMS and FNS, who contribute about 67% of the cost of developing these new systems as well. So why does it take time? And as I was here again 2 years ago, I think it was November of 23, it does take time because it's really complicated work that we're doing. As I mentioned, we did these 3 RFIs to gain feedback from other vendors in other states, but also with a lot of collaboration with the federal government. As I mentioned, there was almost one entire year of multiple reviews and engagements of our procurement documentation to make sure the requirements of the system, the requirements of the solution met the needs and were written in a way that was robust and was really going to deliver the outcomes that we were looking for. We released the request for proposal in October of last year. We are currently in active procurement. I'm very happy to share that we have received competitive bids that meet the needs of our requirements, meet the needs of the outcomes that we're looking to achieve, and meet the needs of the problem statements that we're trying to solve. And all of which have also able to meet the needs of our incremental approach, our phased approach of implementing the solution. So we're very confident that we're in the right position right now. But between now and the middle of next year is where we anticipate finishing off all of the various aspects that you see here on the screen, which include demonstrations, the vendor scoring, vendor selection, and then once we develop a contract, we then need to share that with our the federal partners for their review. And there's also a lot of state internal processes as well to make sure that those contracts are written in a way that meets the needs of the state and the citizens that we serve. As I mentioned, what we anticipate once we're able to start the work, which we expect to be around the middle of next year, we're looking at a timeline of 3 to 4 years. Could be closer to 3, could be in the middle. We'll have to wait to determine with a selected vendor what is the actual implementation path that we're going to be able to share with you moving forward. And then wrapping up, what's different? When you think about this is not the first time that we've tried to do this, and we've had some past challenges. We recognize that. The Vermont Health Connect was launched in 2013, and it was challenging to say the least. We had some rushed timelines, but really what we identified was there was a lack of user support and training. And that really led to actually the role that brought me into state government was in organizational change management, really making sure that we support people when we are going to make a change in a solution or a process with a piece of technology. We need to make sure that we focus on the fundamental simplicity of just tell someone what's changing and why. So we recognized our past challenges. It has directly informed the work that we're doing today. But we also recognized when I came into this role about 4 years ago is that we've actually had a lot of successes. We had past successes in VHC and also access that met the needs of Vermonters at that time. Granted, those efforts that we did were more security, compliance, infrastructure based, but we recognized that we made progress, and the evolution, the shift today is really focusing on people. What do they need? Focusing on the problem. What do they need? What do we need for the solution in the system to be successful? So really, it was a new approach. I came into IE&E in 22, and my focus ever since that day has been focusing on people. What's the problem we're trying to solve, and how can we explain it in a way that's meaningful? How can we understand the problem in a way that's meaningful so we can ultimately find a solution that meets their needs based on the people that we are serving? And lastly, we've been really focused on making sure that we're not just doing this by guessing. The procurement rigor, the engagements with our various compliance and oversight partners has really been focused on doing it the right way. And I think the big fundamental shift is we were focused on outcomes. What's the problem? What does better look like? And that's what we need to lead with. This is what we're looking for. How can a solution, how can technology meet the needs versus how do we find technology that allows us to change the way that we need the service to be applied? So that's it. It's VTIs. I think now's the right time. It's not just about technology. We're really focusing on delivering services to Vermonters in a completely different way, in a way that meets them for the needs that they have. We're very focused on maintaining our federal collaboration with our federal partners. Again, they provide a lion's share of the cost. And we believe that the time is now. The risk of delay is something that we just can't afford. And I think the right time is where we are today. And I certainly thank you for your time. And I'm certainly happy to answer any questions that you might have from around the room. And I certainly appreciate your time today. Thank you.
Thank you. Members of the committee, anyone have a question for Mr. Walker? Oh, and now I can see a hand.
Yes.
So Rep. Priestley, go ahead.
Yeah, thank you. Thank you so much. This was great. I'm just wondering, and this is more of just trying to be consistent with questions across different software. So I'm just wondering, you mentioned you covered a lot of like the vendor engagement and reaching out to other states and things like that. And I'm just wondering, like, there's kind of been a theme of software projects doing the full business requirements and stakeholder engagement during implementation phase rather than before a system is actually procured. And I was just curious, like, do you feel really confident about going to all levels of the stakeholder, ladder, and making sure that you have all the business requirements kind of mapped out before you kind of hit, make that selection?
Yeah, great question. The short answer is yes, I believe we did. The approach that we did with our requirements was actually a little bit different in the sense that we didn't prescribe the technical solution or the implementation approach. We were really focused on requirements that were at a level that focused on the outcome that we needed. We need a solution to do this. We need a Vermonter to be able to do that. We need a solution that can do this and this for us. So we wrote the requirements at a level of detail that brought it a little bit higher in the sense that it was focused on the problem statements that we're trying to solve, which allowed the solution vendors in their proposals to really address with the technology how they would meet those requirements. We have since then gone into more detail in terms of the level of specificity of those requirements. And even then in the iterative approach of actually doing the design phase is we will then revalidate all of the levels of detail of those requirements as well. So, and again, that will be based on feedback from Vermonters, based on the problems that they have, and also, of course, within the state of Vermont with the programs that we serve as well. I think that this and the other approach on this was we were very specific with the problems and the challenges and some of the pain points that we had to then ask the solution vendors to then propose a way that allow them to meet the needs that we're trying to address in a meaningful way. So the point I'm making is we weren't prescribing an approach that we thought was the right approach. We needed to hear from the solution vendors. And now then once we get to a point where we can actually go through that negotiation to then making sure that what we're asking for isn't the long way around to get to the end point when in fact it could be an easier way to get there. And I think the way that we did our requirements allow us to achieve that.
Great, thank you. And can I ask a follow-up, Mr. Chair?
Go ahead.
Okay. And I guess before I ask the question, is the vendor process locked in a way that you wouldn't be able to comment on any given vendor that's in that process at the moment?
That is correct, yes.
Okay, great, thank you.
Question for me, just bouncing off of that. It sounds like the approach is going to bring a brand new system to all users. So Vermonters now or getting benefits, they're going to have to relearn the system. state employees, they're going to have to relearn the system from the ground up.
That is correct. Absolutely. So therein is the criticality of training, user support, change management. There's going to be some changes. We absolutely recognize that, and we're not blind to the challenges that it comes with that. That's really my background, is really focusing on how do we identify what's changing, how do we engage in meaningful ways with communication, collaboration, and training across the board with the monitors and with the state teams that will be using the new solution and new system. So that is really a sort of a critical part of our approach. Again, not just giving someone a new smartphone and saying good luck, it's really making sure they know how to use it.
Any other members of the committee with any questions? Rep. James?
Thanks. Could you talk a little bit more? I'm really curious about to learn just a little bit more about how a project this sweeping yet also integrated gets rolled out and tested. It's not like you have different modules, right? You couldn't roll out Snap and then because it's all one thing. So can you talk a little bit about how you test, refine, and make sure it's all ready to go when you launch? How does that work?
Yeah, also a really good question. I'll do the best I can to sort of explain that. So I think what we anticipate is, and I think part of the challenges of some of the previous efforts have been focused on, we're just going to do a portal, but recognize you still need rules engine. But if we just do a portal and a rules engine, we still need a place for people to actually work in the system. So you need case management. And it's the connections of those modules is really a critical piece. In terms of, and I say that because what we expect the implementation to be, as I shared, was that sort of fundamental framework with then sort of a smaller program that maybe has less complex rules. So the way that we roll this out will certainly be making sure that we can leverage a pilot or a sample group to actually make sure that actually does work. And then recognizing that there is still going to be ongoing connections with our legacy systems. But the approach is to sort of launch a base solution or a framework, if that's the best way to say, that still provides the functionality for that program to actually be successful, which is why we initially think that our approach will likely be sort of base level portal application with some screening that we can start getting people to actually go in and start using the solution. We can start getting feedback. We can test, make refinements based on user feedback before we start adding additional programs. But we want to make sure that we can do that in an incremental approach. I don't know if that gets to the level of detail that you're asking for, Representative James, but does
it
that
does.
Yeah,
Thank you.
Senator Brown?
There's a lot of, call it chaos on the federal level right now in terms of what's being delivered and to whom and how and at what cost. As you look at what you see happening on the federal level, is there anything that you see that will have any significant impact on what you're doing with these programs?
what I see right now in terms of the work on the federal level is all focused. The impact right now is on our legacy systems. We're having to make changes over the next year and a half, 2 years to the Mon Health Connect. There is work that's happening as we speak into the Access mainframe. So the impact that I see right now is we've always had projects that were focused on compliance on our existing solutions. That hasn't changed. The fact is we've got compliance projects that we have to focus on right now, in addition to us focusing on trying to build this new solution. So the impact that I see is certainly on our resourcing, based on the challenges that we have right now to still keep the systems running that we need today until such point as VTIs can incrementally replace those services. Then we can incrementally sort of decommission that functionality in our legacy systems. So that's the immediate impact that I see. It's just based on the speed, the challenges of some of those initial mandates, which comes with any administration, of course. So that's what I see as the immediate impact. based on the work that we're doing primarily with VTIs.
Well, it seems as though one of the things you're doing is you're applying solutions to programs that are constantly in motion and constantly changing.
Yes.
What could go wrong?
Absolutely nothing. So I think therein is having a more modular approach, things that allow us to update, evolve, adjust, modify, change the eligibility rules engine side. I think is maybe too much is the true heart and soul of the solution, is recognizing that there are going to be changes every month, every 6 months, every year, making sure that we can apply those updates in a way that doesn't fundamentally break everything else, because it's all intertwined and interconnected. So that's the beauty of having an approach, having a solution that's modular design. Those eligibility rules will always change. They're policy driven. But what we're seeing today is having solutions that are decoupled in a way that allows us to make those changes, to make sure that we can test in an environment before we release into production, so we can identify what could go wrong. We're also seeing a lot of benefit of leveraging AI to sort of through reporting, finding trend analyses in a way that also helps us identify some of those trends or gaps as well. We're also seeing a huge amount of that we see will be beneficial for Vermonters in getting questions answered. I think today that how often people go to a smart device and go to leverage AI, even if it's just searching on Google to try to find out what can I do, how do I do something, that just the information approach that we're able to leverage, leveraging AI, whether it's chat bots or summarizing materials or helping guide a citizen in the effort that they're trying to achieve, I think will certainly help streamline processes for us as well.
Well, the methodology that you're using, is this something that is semi-universally in effect right now, or are people, do people have other solutions that are materially different than what you're doing? How are they working?
So I think, as I mentioned, that there are different states that, IE&E is not a one thing. This is every state has some form of enrollment and eligibility. The difference is the mix of the programs. What we are doing does exist. It hasn't been done in the program mix that Vermont has. That makes it unique. But it's also, again, based on what we're trying to achieve and the reasons why, certainly it does exist. But there are other solutions out there that, right now, Access, we host that solution. We have to host the technical infrastructure, and I don't know all the specific details, but we have our Deputy Secretary from ADS, but there are different ways to host a solution, to have a solution that you then have to maintain and make sure you can build out the infrastructure. Then there are various solutions that you pay for a service. Then there's different ways that you can also solution it as well. I think that the way that we envision VTIs is to really going to be in a way that protects Vermont and minimizes the compliance risk and the challenges, and allows us to be really agile and nimble to the changes, whether it's from federal government or from the state, or based on the needs of the Vermonters.
And Rep. Sibilia, then Rep. Priestley.
Yeah, thank you very much. And I apologize for coming in late. Perhaps this question's been answered. In terms of the Medicaid cuts that we've seen this year, will that be impacting the funding, the functionality, the oversight of this project in any way?
So I don't know if I can necessarily speak on the financial piece, but in terms of the evolving requirements based on what's coming through from the HR1 healthcare compliance for Medicaid, we need to make sure that we make those changes today from the eligibility work requirements and the various certifications and renewals that need to happen. The VTI solution will need to meet those standards when it goes live. So as things are changing over the next year and a bit, certainly the VTI solution will need to meet those needs. In terms of if there's going to be an additional cost or if there are programs that are available or if they change, the eligibility changes, again, my focus is ensuring that the system and solution that we have can manage and execute that. But I can't speak, unfortunately, to a financial cost.
And Cecilia,
Yes.
if I may, for the record, Kristen McClure, Deputy Secretary of DHS, Garth, I think you answered that really well. I'd like to build off that. So HR1, obviously, we need to implement our deadlines, we need to implement the economic side, the healthcare side. The way we have factored that in is looking at the sequencing of events of implementing HR1 with VTIs. So like Garth said, when the challenges will be resources to make sure we're not drawing on the same resources at the same time. So HR1 will be implemented and those changes will also be included in VTIs. And as part of the procurement process, we have asked the vendors to factor in costs around HR1 changes.
Costs around what?
Costs around the HR1 changes.
And so what safeguards does AHS have in place here in terms of timing for the project and the Medicaid cuts? How are you kind of making sure that's aligned and not getting away from us or surprising us?
Right, I think, Cecilia, it sounds like you're asking about the timing for the HR1 changes, is that correct?
I am, yes.
Yes, so that project is a distinct project, which is currently underway now, working very closely with our ADS team. And they have different go live times and deliverable times that really will span most of next year, because the deadlines are October next year and January 1st, 2027. So that's where we'll see our Medicaid team really focused on HR1 changes. For VTIs, we see them kind of fold in more in 2027 with the work for VTIs for that modernization solution. Does that help?
It is helpful. And again, apologize for arriving late if this question was answered. So I understand that this project relies very heavily on federal funding. We're sure that that funding has not been cut or impacted by the federal cuts.
Well, there have been some changes, as we know, from HR1, but we have factored that into the program, or to the project, I should say.
And what is the scale of the change that we're aware of?
We can follow up with you in writing with that, the cost allocation change around that.
Okay, that would be great. Mr. Chair, I have one other question.
Yep, go ahead.
Just related to AI and the chatbots and this system, what protocols are in place to, regularly check in on privacy protection and, if we are at, the phrase is gonna, if we are maintaining best practices, as that is a pretty active and dynamic policy space, both nationally and in Vermont. What are the, what's the, ensure that we're checking in on that and making recommendations necessary?
So I think it's a really important question. And maybe if I can look to Secretary from ADS to speak to that, as I understand, there's a robust focus on that.
We do have a robust focus on it. For the record, Andrea DeLabrie, our ADS Deputy Secretary. We have the advantage of a cybersecurity council that we are actively engaged in. I think most of you are aware of that. I don't think that there's any immediate plan for IE&E to take that on right now, and maybe I'm wrong, Garth, but I'm not aware of us utilizing AI currently in the landscape that we're in right now, which is active procurement. But certainly if we do engage in that conversation, we would go down the appropriate paths to get the right folks engaged, the right stakeholders, groups of legislative folks, our cyber council. Is there anything you would add to that? The AI council?
I would just say anything that would be implemented we do have protocols and we have our guidelines and ethics for AI. So anything has to meet those, any procurement, if there's AI embedded in there, it goes through the standards to make sure all those protections are in place.
We would not do any decision making in a silo. I think that's the message I'm trying to.
Mhm. So just then to double check my understanding, that this is AI and chatbots and using that for trend analysis is not a part of the current implementation?
Well, the current, we are still in active procurement right now. So I can't comment on what the implementation will be until such point as we have selected a vendor and we have solidified on an implementation plan and more importantly, a solution.
And so if I may then clarify, ADS would have sign off on chatbots, trend AI use of trend analysis, and that would be connected in some way to the Cybersecurity Council?
That is correct. Yes, absolutely. Just to clarify, in our procurement review team was comprised of 50% of representatives from the Agency of Digital Services. So we've had very close collaboration throughout the entire process of this entire.
And thank you very much. I think this is my last question, Mr. Chair. I'm interested in how the legislature does its job and provides oversight specifically on this cyber and data protection piece. So if you could comment on that and then remind me who the legislative representatives are on the Cyber Council.
If anyone can answer that.
The AI Council, sorry.
Sorry, yeah, I think I said cybersecurity, apologize.
AI
It's
Council. Don't believe there's.
We'll have to get back to you on that, but
I'm sorry?
we could follow up with you regarding that. I don't know that there's an active legislative representative.
And I'm sorry, could you give me the name of the council again? Perhaps I've confused two councils.
I think I did that to you. AI Council.
Which is different than the governor's.
The Cybersecurity Council, correct.
Yeah, so.
And Rep. Sebelius, I think Attorney Sagal can shed some light on something.
Rep. Sebelius, there's not a legislative member appointed to it's not required by statute to have a legislative member appointed to this AI council.
There is not one required?
Correct.
Thank you. Mr. Chair, as we are thinking about recommendations going forward into the session, I'd like to make sure that we put a pin in that particular issue. Thank you so much for letting me ask those questions.
Thank you, Rep. Sebelius. Rep. Priestley.
Yeah, thank you. So just for the chunk of time, which is the procurement process, I was just wondering, is the vendor selection likely to be, given that we know the world is in a state of flux and things might get pushed back, but is the vendor selection likely to be July or sooner than that within the procurement window?
Yeah, so we expect vendor selection to be soon, based on the timeline that I shared, which was to execute a contract by the middle of next year. The work that has to happen between July of next year and where we are today requires contract negotiations, federal reviews of those contracts, that contract. So that would imply that a selection would be imminent.
Okay, great. Thank you.
Okay, do we have any other questions? Rep. Stabile and Rep. Priestley, your hands are still up. I'm going to assume that you don't have further
Sorry,
questions.
lowering.
I do not. I'm driving. Thank you, Mr. Chair.
So, and anything else from the room on this project? If not, I think we can move on to CWIS, which I'm not going to attempt to understand the acronym. So, do we need a 5-minute break to swap?
Yes, please.
Let's take a 5-minute break. We'll